Hi, I'm Sylvana Sinha. I am the founder and CEO of Brava Health, which is Bangladesh's fastest growing consumer healthcare brand. And really excited to be here with all of you. And I've really enjoyed hearing from the other startups that are presenting today. Great to meet you. So I'll set the stage just to give you a little bit of background on the Bangladesh economy and the health sector. Bangladesh is the 8th most populous country in the world with a population of 170 million people. It also happens to be one of the fastest growing economies in the world, growing at 5 to 8% consistently over the last 15 to 20 years. Even in 2020, against the backdrop of the global recession, grew at 4% and was identified as one of the most resilient economies of the pandemic. It's a very young population, a very dense population, 3 times the population density actually of India's. And the health sector is growing even faster than the economy, which we often see in emerging markets. The health sector is growing at more than 11% CAGR over the last 15 years, and a lot of that is, that's being reflected in the growth in per capita healthcare spending, which is expected to 5x in the next 20 years. There is another thing that I think is important for everyone to understand is that 1% of the population has health insurance. So it's largely an uninsured population. There is a public health system, but more than 2/3 of health spending is coming from the private sector. 72% of health spending is coming from the private sector, which is similar across the region, actually. So the private sector is providing the bulk of services in this market. Quality is really variable across the board. The average amount of time doctors are spending with patients is 48 seconds. There's only 1 internationally accredited lab in the country, and 10 to 15% of drugs in the market are counterfeit. It was really important to me when I came to trying to solve this problem to build a solution that was grounded in quality infrastructure. Because what we know is across low and middle income countries, more people are dying due to lack of access to quality healthcare services than lack of access alone. Because of this quality gap, you have thousands of Bangladeshis leaving the country every day to access better care abroad. And this is not only the wealthy, you have middle-class Bangladeshis traveling often to India and the region to access better care. And this is resulting in billions of dollars leaving the country, but it's also wildly inconvenient for people to have to leave their own countries to access quality health care. So this is some of the problem that I'm trying to solve. So when I started out, actually, I was inspired because of a personal experience. I was visiting Bangladesh for a family wedding when my mom was actually hospitalized for a basic appendectomy. And the surgery was, it didn't go great, and we ended up having to airlift her to Bangkok. And it just really opened my eyes to the fact that despite the fact that there's been such tremendous progress in the Bangladeshi economy, no amount of money can afford you access to excellent quality healthcare. And so that's what we're actually building. So I moved to Bangladesh 6 years ago, and we started serving patients almost 4 years ago. You can see on the screen here a photograph of our flagship building on the left. Our model is a brick and click model. So it combines infrastructure and technology meaningfully to serve the entire outpatient experience. There are a lot of people who are coming at the healthcare problem either from the perspective of infrastructure or from the perspective of technology. But our model, I like to call it a brick and click model. So you can see the brick side on the left side of the screen there. It's a 10-story building in Dhaka. It's a one-stop shop for all of your outpatient needs. We have doctors who sit there. The first 6 floors are all consultations and outpatient procedures. We guarantee 15-minute appointments with your doctors at Brava. Family doctors, women's health, pediatrics, dentistry, ophthalmology. We also offer integrated outpatient procedures and advanced specialties like cardiology, gastroenterology, orthopedics. Really anything you need in an outpatient setting, you should be able to access at Brava. We also house 6 in-house labs that are set up according to international standards. We're in the process of getting CAP accreditation, which has gotten delayed due to COVID restricting travel for the inspections, but we hope that we'll get through that this year. Full range of imaging services in-house, full range of in-house pharmacy services as well. And the pharmacy, again, only procures directly from manufacturers to eliminate the risk of counterfeit drugs. So everything is really embedded in international standards and quality. Everything is also underpinned by a layer of technology. So we brought Bangladesh's first fully integrated hospital information system, which features the first patient app in the country. our digital products include, basic appointment bookings and medical records, which in and of themselves are very novel because most patients in this market are carrying their medical records around in bags. So with our app, all of your records are in one place, and if you bring us your life outside of Brava records, we'll scan and store them for you to really promote a continuity of care. We've also rolled out other digital products, which COVID really accelerated the rollout of those products. We rolled out telemedicine in March of 2020. We were the first private provider to partner with the government on telemedicine. We rolled out e-pharmacy in May of 2020, and we've been building remote and virtual primary care tools for management of COVID and other chronic diseases. So we've been serving patients, as I mentioned, for nearly 4 years. We have more than 250,000 patients that we have served to date. We've provided more than 1 million services in Bangladesh at a high quality level. We've been growing very fast, and we are basically right now serving more than 800 corporate clients. The corporate client base also grew really dramatically during COVID. So right now we're raising a Series B round basically to fuel our expansion. We reached cash flow positive at the end of 2020. So we're running the business operationally on cash right now, which is very stressful for any founder, but very proud that we've been able to achieve that milestone. But we're looking for cash to help us to really accelerate our growth and expand the business. So that means two things. Number one, we're building a patient super app. So all of our digital products will be in one place in the same way that you have the one-stop shop in the physical setting. Two, we want to build out physical centers. So that was a hub that you saw, the 10-story building. The spokes that we want to build in Dhaka in the next 3 years are a little bit smaller. They're 3,000 to 5,000 square feet. You can see a doctor, draw blood, do a basic x-ray. For anything more advanced, you get referred to the hub. I'll just end with a point that I think is really important, which is that we believe this model is scalable across emerging markets. I've been chatting with a lot of people today about really interesting innovations that are happening in advanced economies. But we don't have to worry about HIPAA compliance in our market. And I think that creates an opportunity. There's less regulation, less competition. Health spending is growing dramatically across emerging markets. I think it's grown 66% in recent years across emerging markets. And the impact angle is also not to be underestimated. For every dollar that you spend in an emerging market, you will achieve at least 4x in value creation.
Thanks very much.
Thank you.
Thank you. Could you talk a little bit about the margins?
Yeah. I love talking about the margins.
Talk a little bit about that.
Yeah, actually, our gross margins are 60% right now. So the margins of the business are very healthy compared to, I would say, pure play telemedicine plays in the market. And that's because of the fact that we offer all the we do everything in-house. So unlike other models that are like Uber of for healthcare, which are important and providing value certainly, but they don't own the supply chain, which is where the margins really are. We own the entire supply chain behind the services that we're offering.
Right, that's great, excellent. Any questions?
Yeah, I have a question. You elaborated a little bit on public reimbursement and the cooperation that you closed. Where do you see the future? Because you mentioned out-of-pocket payers being relatively high, extremely high actually in Bangladesh. So for your business, where do you see most of the revenue coming in the future?
I'm not sure I caught the first part of the question.
So you mentioned you closed a deal with public authorities, reimbursing some of the telemedicine business?
Yes. So that was actually purely voluntary at the beginning of the pandemic. We partnered with the government on their free 333 hotline. The country was in a crisis mode, and we had the capacity, and we stepped up and offered our services. But in terms of the broader question that you ask, all of our business is really out of pocket right now. We do have partnerships with insurance companies, but most of the insurance that does exist in Bangladesh is really just for hospitalizations. What has been more meaningful for us in the last couple of years is corporates. So we offer membership plans which are like outpatient insurance packages, whereby you pay a flat rate for unlimited access to services. And we're the first to bring this type of a product to this market. And a lot of corporates have signed up for those products for their employees. They've also signed up for other products like hotlines, COVID testing, and other types of COVID products as well. I do think that there's been a positive shift toward employers realizing the need and importance of investing in employee health, which a lot of emerging markets aren't there yet, but the trend is moving in the right direction.
Maybe less of a question and more of a statement. I mean, I think you're sitting on a goldmine of data. I don't know if
Yeah.
anybody is competing with you there, but it's an underserved market where nobody is collecting this type of longitudinal data. I mean, I don't know if you're using that in your Series B raise pitch, but that would be the main asset, I think.
Yeah, no, it's a great point. We have a data strategy right now, but we haven't figured out how to value the data yet. And so that's the struggle with really putting a price tag on it for the Series B round. But I would say between B and C is probably where we'll start to better understand that opportunity. But fully agree with you. Even in terms of the records that we're getting from patients from outside of Brava, we're anonymizing those. And so I agree with you completely.
First of all, I want to commend you on an amazing company and ecosystem.
Thank you.
How do you address the question of currency risk? In other words, your margins could be 60%, but if the currency devalues by 70 or 80%, that can negate a lot of the good work. But on the other hand, the currency can appreciate. But how do you deal with that when you're talking to overseas investors?
It's a great question, but to be honest, the currency risk for Bangladesh is much lower than other countries in the region. We have really strong reserves that are backed by exports as well as remittances. And so the taka has been much more stable actually than the rupee. So I can point to that historical track record. I can point to the fact that we have really strong monetary controls, a very good bank, I think. Of course, we can't predict the future, and it is an emerging market, but we've never seen the fluctuations you've seen in other economies.
That's great. Maybe one last question? Maybe some of the folks remote?
Yeah, then maybe from my side, in terms of positioning, you already said you want to focus on out-of-pocket payers. Is that also the vision for the future? And what kind of percentage of the population is actually able to pay for these services?
Yeah, great point. So we actually believe that over time, with the introduction of the remote and virtual services and the expansion of those services, we will be able to serve the entire population of Bangladesh. But today, I believe about 40 million out of the 170 million people in the country can afford our services. And so, and we've actually seen during COVID times, because of the increase in the corporates that are paying for services for their employees, we've been serving a much broader segment of the population, including factory workers and others who aren't paying for themselves. Corporates are paying. So I'll answer your first question then last, which is that I think over time, we do expect the corporate business to grow. It would be great if the insurance business also grows, but the insurance sector is still at just 1% saturation. So that is going to take time.
Fantastic.
Thank
Well
you
done.
for the question.
That's great. Thank you so much.
Thank you.
Yeah.